Male urethra. The urethra is a tubular passage which transmits the urine and seminal fluid in males and only the urine in females. The study of the urethra is important clinically as to perform procedures like catheterization and cystoscopy. The urethral rupture is also important, is very common. Now the male urethra, it is about 18 to 20 centimeters long. It extends from the internal urethral orifice. This is the internal urethral orifice at the neck of the urinary bladder to the external urethral orifice at the tip of the glans penis. In the flaccid state of penis, the long axis of the urethra presents two curvatures, 1 and 2, and it is therefore S-shaped. In the erect state of the penis, the distal curvature it disappears, and as a result the urethra becomes J-shaped. According to the location, the urethra is divided into three parts. Prostatic part that passes through the prostate, membranous part that passes through the urogenital diaphragm. This is the urogenital diaphragm, and this is the membranous urethra, and the spongy part that passes through the corpus spongiosum of the penis. Now the prostatic part of the urethra. It is about 3 centimeters long. It traverses through the anterior part of the prostate. It is the widest and most dilatable part of the male urethra. It is fusiform in cross section. The inner aspect of its posterior wall presents some features. So this is the prostatic urethra. This is the posterior wall of the prostatic urethra. We can see some features in it. First is the urethral crest. This is the urethral crest. It is the median longitudinal ridge of the mucous membrane on the posterior wall of the prostatic urethra. Second is the colliculus seminalis or the verumontanum. This is the colliculus seminalis. It is an elevation in the middle of the urethral crest. The prostatic utricle opens on the summit of this orifice. On either side of the opening of the prostatic utricle, there is the opening of the ejaculatory ducts. Now prostatic sinuses, these small holes, these are the prostatic sinuses. These are vertical grooves on either side of the urethral crest. Each sinus presents 15 to 20 openings of the prostatic glands. Now after this we have the membranous urethra. Membranous urethra, it is about 2 centimeters long. This is the membranous urethra. It's about 2 centimeters long. It traverses through the urogenital diaphragm and pierces the perineal membrane about 2.5 centimeters below and behind the pubic symphysis. Below and behind the pubic symphysis. It is surrounded by the sphincter urethrae or the external urethral sphincter muscle, which serves as the voluntary control of the bladder. With the exception of the external urethral meatus, it is the narrowest and least dilatable part of the urethra. Numerous mucous glands are often found in it. In cross-section, its lumen is star-shaped. Its lumen is star-shaped in cross-section. Now, after this, we have the spongy part of the urethra. Now, spongy part of the male urethra. It is about 15 centimeters long. It traverses through the corpus spongiosum of the penis. It first passes upwards and forwards in the bulb of the penis to lie below the pubic symphysis. It presents two dilatations in the bulb of the penis, that is known as intrabulbar fossa, that is 3 centimeters long, and second dilatation in the glands of the penis, that is known as navicular fossa or terminal fossa, that is 1.25 centimeters long. In cross section, the shape of the spongy urethra differs in different parts. In the intrabulbar fossa, the shape is trapezoid, and in the external urethral orifice, it is vertical slit, while in the spongy part, it is transverse slit. The small, simple tubular mucous glands called urethral glands of Litter open in the entire spongy part of the urethra except in the terminal fossa. The pit-like small mucous recesses, the urethral lacunae of Morgagni, project from the entire spongy part of the urethra except in the terminal fossa. So there are mucous recesses that are known as lacunae of Morgagni. One lacuna present in the roof of the terminal fossa is called lacuna magna. This is the lacuna magna or sinus of urine. The external urethral orifice is the narrowest part of the male urethra. It is in the form of a sagittal slit about 6 millimeters long. There is a congenital anomaly condition that is known as hypospadias, in which external urethral orifice is located on the inferior or ventral aspect of penis instead at the tip of the glans penis. It occurs due to the failure of fusion of urethral folds. Depending on the location of external urethral orifices, these are the external urethral orifices, the hypospadias are classified into 5 types. Glandular type. It is if the external urethral orifice opens on the under surface of the glans, it is known as glandular hypospadias. Another is the balanic or coronal. If the urethral orifice opens at the base of the glans penis. Another is the penile. If urethral orifice opens on the ventral aspect of the body of the penis. Another is the penoscrotal. If the urethral orifice opens at the junction of penis and scrotum. Last is the perineal. If the urethral orifice opens as a sagittal slit on ventral aspect of the scrotum. Now, internal urethral sphincter. It surrounds the internal urethral orifice and is probably formed from the muscle of the bladder wall, this red colored. It is involuntary in action and often termed sphincter vesicae. It is supplied by the sympathetic fibers from lower thoracic and upper lumbar segments of the spinal cord from T11 to L2. It relaxes during micturition but closes during ejaculation to prevent the retrograde entry of semen into the bladder. Another is the external urethral sphincter. It surrounds the membranous part of the urethra and is derived from the sphincter urethrae muscle. It is voluntary in nature and supplied by the pudendal nerve. Okay, it helps into the voluntary control of the micturition. Rupture of the urethra. It leads to extravasation of the urine. The commonest site of the rupture is the bulb of the penis, just below the urogenital diaphragm. Following a fall and astride against the sharp object, the urethra is crushed against the edge of the pubic symphysis, against the urine extravasates into the superficial perineal pouch and passes forwards over the scrotum, penis, and anterior part of the anterior abdominal wall deep to the membranous layer of the superficial fascia. That is known as superficial extravasation. If the urethra ruptures above the urogenital diaphragm, urine escapes above the deep perineal pouch and may pass upwards around the prostate, bladder, in the extraperitoneal space, that is known as deep extravasation.